This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
You probably see the signs before you get the official diagnosis. Your toddler is cranky, feverish, and tugging at their ear. All signs of
an ear infection. That's right. And 3 out of 4 kids will have an ear infection by the time they are 3 years old. And recently, the American Academy of Pediatrics released a new set of guidelines on how to treat the common ailment. Dr. Andres Kovacs is the chief of pediatrics at Peninsula Regional Medical Center and joins us this afternoon with more. Thank you for taking time out of your busy schedule to visit us. You know, ear infections are generally treated with antibiotics, but these new guidelines are saying may not always be the best medicine.
That is correct, and you have to understand ear infection is not as simple as a red eardrum or an ear pain. So the American Academy of Pediatrics had put out a very extensive guidelines how to diagnose, how to treat the discomfort, and how to manage ear infection or otitis media.
So how are the new guidelines different from the ones before?
You're very correct. There was a guideline in 2004, and the new guidelines tends to incorporate the new body of evidence that has emerged since then. And before 2004, there was a real leeway treating patients less than 2 years old without antibiotics. And with the new guidelines, we do have a chance to treat younger patients without antibiotics in certain circumstances.
Now, an ear infection is a bacterial infection. So when are antibiotics, I guess, called for?
Well, ear infection needs to be, well, first of all, a firm diagnosis needs to be established for an ear infection, and that requires some skills. And after that, depending on the severity, age of the child, and other circumstances, you can decide to either use an antibiotic or watchful waiting for a couple of days to see if antibiotic will be necessary or not.
And when you're talking about severe symptoms, what are they?
Severe symptoms constitute high fever, pain for more than 2 days, and ear drainage, of course.
Okay, and that's for 2 or younger if they have an infection in both ears. Is that one of the criteria?
If children have ear infection in both ears, then and they are less than 2 years old, that constituted a requirement for treatment, for antibiotic treatment.
So what causes an ear infection, and why is it kids seem to get them more?
Let's take a step back.
Okay.
All children born with a very naive but very good immune system. So in the first couple of years of their lives, they go through the very common colds that you have seen a million times.
Right.
But this is the first time for them, so they have a much more severe symptoms with them. Plus, anatomy of a child makes them much more prone to develop ear infection. So typically what happens is after you develop cold symptoms, you get congested, you have a runny nose, you have a fever, and there's a little tube that runs between the middle ear and the throat. It's called the eustachian tube. That stops functioning. As it stops functioning, it just causes for an ear infection in a young child.
Oh, okay. All right. Sometimes the kids wake up in the middle of the night and they've got the symptoms, the fever and the ear pain. What should you do then?
Very, very good question. Recent study has shown that signs of ear infection doesn't necessarily mean an actual ear infection. Parents are right only about 50% of the time when they see those signs.
Right.
So the first order of business would be treat the discomfort, treat the fever, treat the pain, and then see your provider.
Right, so control the pain, and you can use like an over-the-counter pain reliever.
Tylenol, Motrin would be absolutely appropriate. Heating pad tends to be a relieving factor as well.
All right.
Now, if you go online, you said something about this morning, an app that is supposed to be able to help a parent determine whether or not it's an ear infection.
It is a slippery slope. If you read carefully the diagnostic guidelines with the current recommendations, ear infection is diagnosed with not just looking at the eardrum, but trying to provide a little pressure to that eardrum to see if that eardrum is able to move. Basically, you want to see if there is any fluid accumulated behind the eardrum. So the red ear doesn't necessarily mean an ear infection.
And
so looking at it just without
phone.
any expertise does not necessarily lead you to the correct diagnosis.
And of course, the best way to not have an ear infection is to be proactive, and there are some steps to possibly prevent, make sure that the children's vaccinations are up to date. Breastfeeding is always good for at least the first 6 months of the child's life, and keep your child away from cigarette smoke.
That is very correct. And make sure that your child gets appropriate immunizations. The pneumococcal vaccination is very important in that regards because pneumococcus is one of the leading cause of an acute otitis. Influenza vaccination is very crucial as well. And without saying, not exposing your child to cigarette smoke is very, very important.
Doctor, thank you so much
Thank
for
you.
Thanks for having me.
Good information. And if you want more information from PRMC on proper care for ear infections, go to delmarvalife.com. Click on the show tab, now located on the left side of the home page. Caring for our children doesn't just mean our kids, but our pets too. Up next, how to make sure your furry family member gets the care he or she deserves when it's boarded.
And Brian's at the Seaford Animal Hospital to talk about another important topic when it comes to our pets, their health. Brian?
Well, Jimmy and Lisa, just like humans, it's important for our pets to get a yearly exam, especially our cats. And when we come back, we'll talk about some diseases that, if detected early, can actually be treated, and getting your cat into the cat carrier. Cat owners know it can be stressful. We'll give you some simple tips to make it a little easier. You're watching Delmarva Life. We will be right back.